Former CDC Director Susan Monarez testified before lawmakers on Capitol Hill today in the wake of her firing last month. Alongside her was Dr. Deborah Howry, who resigned from her position as the agency's chief medical officer.
Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign.
I want to bring in Dr. Céline Gounder. She is the editor-at-large for public health at KFF Health News and a CBS News medical contributor. Dr. Gounder, what did Dr. Monarez say about her firing?
Yeah, just to reiterate some of those comments, she testified that HHS Secretary Kennedy demanded that she pre-approve every vaccine committee recommendation and dismiss career vaccine policy officials. And she refused. That refusal ended up costing her her job. She also describes the weeks leading up to that day with liaison experts, for example, from the American Academy of Pediatrics, removed from ACIP working groups. The ACIP, remember, is the external advisory board to the CDC, concern that the ACIP might alter the childhood schedule without credible data. And in the middle of all this, the August 8th shooting at CDC's Atlanta campus that killed Officer David Rose. And she added that in a morning meeting, the secretary had said, quote, the childhood vaccine schedule would be changing starting in September, and that he wanted her on board, even though there was not science or data to support such changes.
So I want to clarify something, because several senators did bring up vaccine mandates during today's hearing, as well as concerns that vaccine mandates have led to mistrust in the CDC and vaccines. So does the CDC actually mandate vaccinations?
I think this is a very, very important point. People think the CDC was mandated in vaccinations for COVID. They think the CDC mandates vaccines for school entry. That is not correct. In the United States, school vaccination requirements are established at the state level. Each state determines which vaccines are mandated for children to attend public and private schools or to go to child care facilities. These requirements are typically enacted through state laws and regulations and are enforced by state health departments or school systems. So while the CDC provides recommended immunization schedules through the ACIP, these serve as guidelines, and the states have the authority to adopt or modify or reject those recommendations.
So speaking of states, what do you make of the governors of California, Washington, Oregon, and Hawaii coming together to issue their own vaccine recommendations for their citizens? I mean, this is sounding a lot like the times of COVID, where each state had its own kind of guidance on how to deal with this virus.
Well, and that's the point, is each state has the ultimate control and authority over public health. So each state can do their own thing. And what we are seeing now is this West Coast Health Alliance of Washington, Oregon, California, and Hawaii. And they have decided to focus on medical professional societies in deciding what their recommendations are going to be. And they are recommending that anyone who wants a COVID shot, child or adult, anyone who wants one should be able to have one.
Okay, so just real quick before we go, there's a lot of parents out there and individuals who are wondering about their own vaccines. Where should people go to for information on vaccines? What should people do when it feels like you're getting conflicting information coming from different sides here?
Yeah, there are a number of different medical professional societies, experts, scientists, doctors who see patients, whether they're children or adults or pregnant women. So you have the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, you have the American Academy of Medicine, American College of Physicians, and the list goes on. But really focus on those medical professional societies. These are the people who care for patients and care about their patients.
Dr. Céline Gounder, thank you so much.